Mr. Shadegg is next.
Thank you, Mr. Chairman. This is the most sweeping piece of legislation to come before this Congress in decades. It is coming before us under a deeply flawed, undemocratic, and inappropriate process. Rank and file members of the majority are not responsible for that flawed process, but it is still wrong. It is wrong that CBO has not had a chance to score the bill with a copy of the bill before them. It is wrong to attempt to force this Congress to pass this legislation in less than 2.5 weeks without allowing members of this Congress to come to terms with what the bill will do and without allowing the American people whose lives will be affected to evaluate it. Let me state unequivocally, I passionately support health care reform. In my tenure of Congress, I have worked on health care more than anything else. I have fought to reform the system we have, which deeply needs to be fixed. I have fought for patients' rights. Let me also say that there are issues on which we agree and things we could pass on a bipartisan basis. Republicans agree we must cover every single American. Republicans agree we must cover those with pre-existing conditions and chronic illnesses and enable them to buy health care at a fair price equal to that bought by the healthy. Indeed, it was my bill, a Republican bill, that passed this Congress 3 years ago to create state high-risk pools and try to address the problem of those with pre-existing conditions. Day before yesterday, I introduced a bill, the Improving Health Care for All Americans Act. It provides care for every single American. Every American. It provides affordable coverage to every American with a pre-existing condition and every American with a chronic illness. I know about pre-existing conditions because my sister is a breast cancer survivor, and she was locked in her job for years. But we can reform health care without a massive government takeover. This bill is just that. 83% of Americans who have health insurance in America today are satisfied with their care. My bill would let every single one of them keep that care without change. The bill before us will force every policy in America to change. Every single plan in America will change. Contrary to the claims of so many, if you like what you have in America, be prepared to lose it. Don't take my word for it. Don't believe John Shadegg. Read Section 102 of the bill. It empowers the new Health Benefits Advisory Board and the commissioner, my colleague, Mr. Stupak, just referred to set new mandates for every health care policy plan in America. Every employer-sponsored plan, every plan in the individual market. Mr. Chairman, I implore you and all of those on both sides of the aisle, let's pass what we agree on. Let's cover every single American. Let's ensure that those with pre-existing conditions and chronic illnesses can get care at a reasonable price. But then, let's work together jointly to resolve our differences and control costs. That's the biggest issue here. We should not, I repeat, we should not force the 83% of Americans who like the health care plan they have to give that plan up. It's just wrong and it's unnecessary.
Gentleman's time has expired.